What's our favorite spinal decompression exercise that you can do for your lower back at home? Now, before I get into this, make sure you hit the subscribe button and the notifications button and the bell somewhere under this video now, and make sure you don't miss out on any of our future content about the back, the neck, just being generally healthy, how to stay fit, and our Back in Shape app as well. So, what's our favorite spinal decompression? People always ask, they call the clinic, we see patients time and time again that have compressive issues and they want something that they can do to actually take pressure off that spine, particularly when we're talking about the lower back. And in the clinic here, we see time and time again these sorts of disc compressive pathologies, these problems where the person's squashing down on that disc and they want to decompress that spine, get that feeling of stretch through that spine in a safe way that's actually not going to cause any damage, but help that healing process and take the pressure off here. And quite often nowadays, you're seeing patients that are sat in desks all day, then you're sat on the tube on the way home or the bus, and then you're sat at home having dinner, and then you sit in front of the computer to do some more work or sit in front of the TV. And all that time, everything's just squashing down and squashing down and squashing down. And there are a number of exercises you can do, or people get recommended to try and ease the tension on the lower back, but they don't really decompress the real weight-bearing structure of the spine. They might stretch the muscles a little bit, but they're not really getting to the proper core of the problem. Now, some of those might include things like knee hugs, where you hug down here and you stretch all the muscles that run along the back here, which is fine. It's not a big exercise we're very keen on if you've seen any of our other videos, but it's a stretch people do to get a little bit of relief. The one that we prefer is something we call the lumbar disc stretch, and this is a super simple one you can do. Anyone can do it at home. You do it for around 3 to 5 minutes at a time. Works perfectly after a long day's work, or even if you can in the office, or even after a workout. Something that I personally do after I've done any cardio or any of the sort of heavier weightlifting. I'll jump on the towel, rolled up towel in that lower back, and it really helps. And I'll run you through how it works now. But what it's essentially doing is, when you're sat down all day, or doing any sort of weight-bearing activity or running, those sorts of things, you're putting a lot of compression through these discs, and you notice how the spine tends to start to lose its curve. And that often happens when we're sat down, especially if you start to slouch in front of the TV or in front of the computer or in your office or on your telephone. And what we want to do instead is start to get that curve back in the spine. You can see on the front of the bones here, those disc spaces opening out. The easiest way I think of explaining this to patients is that curve might be in lane 1, we want to move it to lane 8 of an Olympic track. The distance is longer, and therefore it puts stretch through all of the discs in your lumbar spine, but most commonly these bottom ones down here, which patients are frequently injuring, the L4-5 and the L5-S1. And those are the ones that take the brunt of a heavy day's sitting in front of that computer. And what you do is you simply take a rolled up towel, about the size of a foam roller, so about that wide. It's got a bit of a give in it. Wouldn't necessarily advise you doing foam roller first time. Using the towel works a bit more nicely. It's very relaxing. And then you simply place it at the base of your spine. Now, if you find those two dimples at the base of your spine, they're about here. So people often misunderstand that your spine's kind of finished there. This is the sacrum. It's not, nothing's moving down here. It's touch up here. Your belt will often sit in this spot here, a little bit higher than you think. So find those two bony bits, come up about an inch or so, and that's where that towel is going to sit. And you lie on your back like so, with the towel straight under there, and that just creates this nice arch, opens out these disc spaces. Think of them like sponges. If you take a sponge that's got a lot of soap in it, you squeeze it really tight because it's been squeezed all night, and then you put it in the sink with water in it and let go, and it just fills that sponge back up with nutrients from around in the surrounding area. And done repeatedly, it can also help with pumping out waste products as well. So you do that, lie there for 2 to 3 minutes, and then when you're finished, simply roll off. Now you can do this for 5 minutes, 7 minutes, 10 minutes. Wouldn't necessarily advise you doing it for much longer than that. It's a fantastic spinal decompression stretch that really is taking some pressure off those discs. And for the overwhelming majority of people with back pain that we see here in the clinic, we do an awful lot of spinal imaging with most of the patients that come into the clinic. It's much more common than not, there's some element of reduction in the lumbar curve. The spine's too flat. And this disc stretch really helps open out those discs and decompress that lower section of the spine. And it's so easy to do at home. You can do it in the gym, at home, in the office, as I mentioned already. And do please give it a go. Try it. Remember, you can buy a comment in the comment section below. Let us know how you got on with it, or any other exercises that you've tried to sort of decompress that spine. And remember, if it's not quite getting to the root of things, you can always get in contact with the clinic. You're doing things here like spinal decompression and IDD therapy, which are more mechanized, more robust ways of actually directly, therapeutically in the clinic with us, actually taking pressure off those discs. And they're fantastic therapies that can be done as a sort of a treatment to deal with more acute episodes or chronic episodes, or something that I personally do a couple times a week just to stay healthy and to keep the pressure off the spine. You might not have access to the table yourself on a daily basis, but this stretch here is really going to be helpful so that you hopefully don't end up coming to have to see us. So, hope you found this video helpful. It's all about self-help, trying to get you in a place where you can take charge of your health and make sure that you don't need to go anywhere. But if you do, you know that we can really help you at the Mayfair Clinic. So thanks for watching. Speak soon.